Hello, everyone, and welcome. My name is Corey Thornton. I am the General Manager for Market Intelligence at Open Minds. Today, as part of our weekly Executive Web Forum series, we are presenting a conversation with the leadership of the Convenient Care Association, including Tine Hansen-Turton, Executive Administrator, Convenient Care Association, Angela Patterson, Vice President of CVS Health and Chief Nurse Practitioner Officer of CVS MinuteClinic, and Dr. Marc Watkins, Chief Medical Officer of Kroger Company and Kroger Health. I would remind you that today that you will be muted, but we want this to be an interactive session. And if you have any questions at any time during the forum, please ask them in the GoToWebinar question box. Also, the slides and recording from today's briefing will be available on the Open Minds website starting tomorrow. Before I get started and hand it over to Tine, can you guys see my screen?
Yeah.
Okay, the slide deck will include a bio of today's speakers. And the agenda today will be a brief look at retail healthcare today, as well as an overview of Convenient Care Association, CVS MinuteClinic, and Kroger Health, and then a roundtable discussion with our leaders. For the background, what is retail health clinics? They are walk-in healthcare facilities located in commercial stores at extended evening and weekend hours and accept most insurance and cash payment. Typically, these clinics treat common illnesses like injuries, vaccinations, and conduct physical examinations and health screenings. Last count, there are approximately 3,300 retail clinics providing health in 44 states and Washington, D.C., accounting for over 40 million patient visits per year. In effect, over 20% of U.S. adults use retail healthcare. For the Open Minds viewer, and for executive teams of specialty provider organizations, the increase in retail healthcare locations raises a host of strategy questions we would like you to keep in mind today. Retail clinics, whether offered in the retail chains or health systems, are increasingly offering services for managing chronic conditions, including mental health. They are also investing more in marketing and have an edge in the direct consumer outreach. The winning combination from our perspective for specialty organizations includes building a strong brand with market positioning preferred by the target consumers, incorporating the elements of concierge care that make it easy for consumers to find you online and schedule and access services, as well as offering face-to-face services or access to virtual services. With that, I would like to turn it over to Tine.
Thank you so much, Corey, and thanks for having us. I'm very excited to be here and sort of guide this discussion with two of my colleagues, Angela and Marc, and they're absolutely the experts in this industry. I have had the fortunate opportunity to work with retail clinics since day one, which was in the early 2000s or 2000 when the first clinic started. Corey, can you go to the next slide? Early on, I think still today, the industry as a whole was coined a disrupting the status quo in healthcare. And I would say a lot of that had to do with really how the clinics were started. Personally, I worked in the 90s with nurse practitioners and around the country opening clinics in underserved areas. And in about 2000, had some what I call healthcare entrepreneurs and venture capital companies knocking on my door saying, we're kind of watching what's happening with nurse practitioners providing access to healthcare in underserved communities. What do you think about the idea of actually going mainstream and have more nurse practitioners working in retail settings and expand access to healthcare to the general population? And since then, which is really when it started in 2000, what became MinuteClinic, the industry took off. And I would say the disruption was the place of location, but also the use of non-physician providers. At that point, there was a physician shortage, about 40% in the country. There still is a physician shortage, actually family physician shortage. And again, this was about creating accessible, affordable healthcare opportunities and quality-oriented healthcare opportunities in the community. And you can't get a better place in this country than in retail settings. So next slide, Corey. So Corey, in his introduction, just mentioned briefly what retail health clinics are. And again, small facilities. I think the key here is that they're located in high traffic retail outlets. So you have retail pharmacies. You're going to hear from CVS MinuteClinic, from Angela, or large grocers, so grocery stores. You're going to hear from Marc Watkins and what they're doing in the Kroger, chain, and then also big box retailers. They're still to this day, and we're now 21 years into it, staffed primarily by nurse practitioners and physician assistants. I would say that the complement of services now are much broader, comprehensive primary care, acute illness, chronic disease, and you also hear the introduction of mental health services, for both of my colleagues. And in general, I would say wellness services. This is about providing that access point in the community where people are. And again, they have lots of partnerships with payers and employers, and have been very strategic in how they've partnered. Go to the next slide, Corey. So here you'll just see, an example of services. I don't think we have to spend much time on that, but as you can see, it's pretty comprehensive. So go to the next slide, Corey. So the industry today is important. So there's an important look back. Yes, we are, 2,300 retail clinics in 44 states, including also some new clinics in other countries that we have actually helped give birth to. But when we started the trade association, which officially came together in 2006, formed by, and this is important, by the members that run the clinics themselves, we had about 150 clinics. One of the first issues we were sort of up against was, I would say, policy pushback. And this is when you disrupt, there'll always be the stakeholders that are worried about losing things, lose money, whatever it is, will go up against you. So we had, over a period of probably 5 years, about 300 to 400 pieces of legislation introduced that would negatively impact the ability for retail clinics to operate in all states at some point. I'm very happy to say, by working together as a team, and this is where the trade association and members come together, working together, we were able to, through education and through our consumers that played a huge role, convincing policymakers that this is a great way to provide accessible, affordable, quality care. I mentioned the triple aim, access, quality, and and affordability. I think we used that term, I think my colleagues will agree, way before it became fashionable, because we knew that from the get-go, this had to be services that were high in quality. And I've been in healthcare for 25 years. This is the only industry that I've seen focus so much on quality care and quality services. To this day, this is still the most affordable way. We are the lowest cost provider for primary healthcare and behavioral healthcare, which is key, as well as in providing access. Think about one in 6 people, and I think one American lived within 6 minutes of some sort of retail setting. That's huge. So talk about this. Go to the next slide, please. Here's a map of the concentration, primarily of the retail clinics, and then just go to the last slide, my last slide, Corey. And again, as Corey said, we sort of took the country with storm, and by working together, I think positioned the industry very importantly. I don't think any of us thought that we would have been mainstreamed into healthcare as quickly as we did. And looking back 21 years, and it's now a very much an adopted healthcare provider. But I also think that disrupting the way healthcare was delivered in the settings, using a different provider, it really gave birth to other, I would say, adaptions in the model. With the model, we have telehealth, we have on-site medical care, and we have mobile technology now where people get access to care, and all of that has been incorporated into our members at this point. With that, I'm going to turn it over. This is sort of the overview. We'll have lots of time for discussion. I'm going to turn it over to Angela from MinuteClinic and CVS Health.
Great. Thank you, Tine, and hi, everyone. Thank you for the opportunity and privilege to join you today. Next slide, please. So MinuteClinic is the medical clinic located inside select CVS Pharmacy and Target locations, and we are part of the overall CVS Health enterprise. Next slide. And MinuteClinic has gone through 20 years of evolution, certainly from it's our early days as a healthcare disruptor to where we see ourselves fitting today as a complement to the broader primary care-based health system, as well as a community-based access point to help fill those gaps in care. Next slide. Today, MinuteClinic spans across 35 states in DC, operate more than 1,100 clinics. And, as was our commitment right from the early days, we are available for care 7 days a week, including evenings and weekends and holidays. Our clinics are staffed by nurse practitioners and PAs, as well as nurses. And today we have a workforce of more than 3,000 NPs and PAs and about 2,000 nurses who are our on-the-ground care team assessing, treating, caring for the patients and families and communities we serve. Some of the things that we're particularly proud of, in addition to our quality delivery, we practice evidence-based care. We are Joint Commission accredited and have been so since 2006. Costs of care received at MinuteClinic in peer-reviewed studies have shown that costs at our site as compared to other sites for same conditions can be at least 40% more affordable. And we are electronic health record enabled, and we have always worked from our early days to ensure that we were, with patient permission, sharing our medical records with primary care providers and working hard to ensure the sharing of data across organizations to ensure continuity of care. In addition to, our quality program being Joint Commission accredited, we are very proud of our top-notch HEDIS scores and our steady hold at 95% overall patient satisfaction, and a Net Promoter Score of right now we're running about greater than 85% on a Net Promoter Score, which is a measure of loyalty, something that we see as an important part of measuring how we're doing in terms of delivering a quality patient experience. Next slide, please. Today, if you look across our reach, we're located, as I said, brick and mortar across 35 states. In DC, we've also added our e-clinic, our virtual care access modality. And, relative to our face-to-face capabilities, where we sit today, more than 50% of the US population is within 10 minutes of care at a MinuteClinic. Has been really tremendous in supporting not only care delivery at the local and regional level, but also being able to support programs like public health efforts, flu vaccinations, or even just the work that we engaged in over these past 15, 16 months during the pandemic to support, public health initiatives in key areas of care delivery. Next slide. So, we've evolved over these past 2 decades from our earliest days, which I think we probably did, our service scope was probably 10 items long, where today we really have continued to enable our practitioners and our nurses to care for our patients across the lifespan. We start at 18 months of age and then throughout through seniors. And our service scope includes acute care assessment and treatment for common acute presentations, minor injuries, our preventative service scope, including vaccinations, travel health, screenings, health risk assessments. We've expanded to the care of patients with common chronic conditions such as diabetes, high blood pressure, high cholesterol, as well as supporting wellness services, preventative services, smoking cessation, weight management, and over the last few years have continued to assess the needs of our patients and ensure that our service scope in our ambulatory care settings are meeting their needs, and including expansion to things like young adult health, women's health, as well as assessment and treatment of sexually transmitted infections, for example. And patients can access our care delivery through digital means, whether online, they can schedule an appointment in our brick and mortar, they can walk in to be seen, and they can now also access care 24/7 through a MinuteClinic video visit in select states or through our e-clinic virtual care modality. So continuing to meet the needs of our patients and meet them where they are. Thank you.
Corey, you want to go to the next slide? Great, thanks. And we'll have a chance to talk with Angela. So next we have Marc from Kroger Health.
Yeah, hi, Tine. Thank you for having me, and it's always wonderful to be on with Angela. And I want to thank the team at Open Minds for having us. Next slide, please. A little bit about Kroger and what we do. we have something that's just very simple. We want to simplify healthcare by creating solutions that combine health, wellness, and nutrition, and we want to connect with people on an emotional and personal level. And that's important for us as we're the nation's oldest and largest traditional grocer. And you might be wondering, why is a grocer in the healthcare business, right? So we've been in the pharmacy business for almost 4 decades. We operate close to 2,700 locations around the country in 38 states, including the District of Columbia. We operate under many different brand names, and so depending on what part of the country you're in, you may not be all that familiar with Kroger, but we operate brands like Ralph's and Harris Teeter, and we also operate Mariano's, Food for Less, and many just well-respected grocer names that are primarily based in the communities that we serve. Let me give you a little bit of background about Kroger Health. Just like Angela's team, Kroger Health is like CVS Health, made up of a lot of moving parts. We have roughly about 22,000 associates that service about 17 million customers a year. We have 2,200 pharmacies, and in an average year, we fill about 210 million scripts, and these are unique scripts that we fill. We also operate about 225 retail clinics, and this is where I spend a good part of my time, but I support our entire line of business. But we also have a specialty pharmacy, as well as a pharmacy benefit management system as well that we offer. We cover about 400,000 lives in that system. And then what I get really excited about, and I'll talk about in a minute, is our core competency as America's Grocer. We offer a nutrition and dietitian service that I think is really impactful, and I'll be able to talk a bit more about that. Next slide, Corey. And as you can see here, this is kind of just a footprint of what we do in a snapshot. This is a little bit outdated from 2018, but it's all pretty relevant. As you mentioned, that you heard Angela mention, we have about 700 board certified nurse practitioners and physician assistants. We operate clinics 7 days a week, early morning hours, extended hours in the evening, holidays, weekends. The only day that we're actually closed is Christmas Day. So what is true today is still true even 15 years ago. Like Tine mentioned, that access is still an issue for many Americans. We've been board certified. I'm actually accredited by the Joint Commission for the past decade or more, and continue to look forward to our next survey, which is headed this way in 2021 sometime. So, and just like Angela and her team, that is something that we do because of what we believe in quality, right? So you see this evidence-based medicine focused. And so Angela and I share similar beliefs that we want our practitioners to practice at the top of their license. And that's including our pharmacists and our dietitians. We really want that because that's what patients deserve. So we offer, like Tine talked about, we offer this triple aim, right? Lower cost, high quality, access, convenience. We have great loyalty with our folks, but we want to deliver a very meaningful visit. So next slide. We are nearing the end of this pandemic, and we're still in the tunnel, but we can see the light at the end of this tunnel now, with more than 40% of Americans vaccinated, and those numbers continuing to climb. Our registered dietitians are both in store and on a virtual platform covering all 50 states. And throughout the pandemic, we've been offering free dietitian visits and these nutrition visits that have been very well received. I think what we're going to find at the end of this pandemic is that the obesity epidemic is right here, right now. If we're thinking about the cost of care and the conditions that are associated with obesity, like diabetes and heart disease. We're going to see tons of that. We're going to see tons of things like a non-alcoholic fatty liver disease kind of exploding onto the scene just because of this obesity epidemic. So we've been poised to launch weight management programs, things that really are impactful, teaching folks how to shop and teaching folks how to purchase nutritious foods at our stores or online. So next slide, Corey. Through this, we put food right at the middle there, and I think it's important to just maybe unpackage our strategy, right? It's these balloons, right? But at the middle of what we do, our core is food, but our strategy is focused on our associates, customers, our core, which is our analytics and the things that we do from measurement and actually analyzing loyalty and understanding risk and risk patterns. Our partnerships are very important to us as well. So I'll talk a little bit about why partners are important. But what we've been doing is leaning on our consumer packaged goods folks to offer healthier foods. And I'll talk a bit more about that in just a bit. And then finally, just like Angela mentioned about connectivity and continuity of care, we're launching a proprietary Assure Care platform that runs on the backbone of a MedCompass platform that's able to ingest both pharmacy claims data, medical claims data, as well as loyalty data from not only our shoppers, but where our analytics team, 8451, begins to crunch those data points to understand and develop a risk model to actually detect things like diabetes before they start, right? So we have some of those abilities and are partnering with large payers to put our population health solution forward. So next slide. And you can go right to the next slide. Food as medicine is really where we've been doing some interesting work. And what I mean by food as medicine, it's a dedicated and educated approach to eating and enjoying food so that we can live healthier lives and prevent illness before it starts, right? So we want to use food, and our CEO and our president of Kroger Health, CEO of Kroger, has said we want to fill less prescriptions in the future. So metformin is a diabetes medicine. We want to fill a whole lot less metformin, and we rather folks have a food prescription. So instead of just metformin alone. So next slide, Corey. As I mentioned, we are really invested in our food as medicine strategy, and it's really to drive a better solution. So I'll unpackage that on the next slide, Corey, please. So by 2025, we have an incredibly bold plan of improving by 20% in these 5 areas that we believe are the most important. As I mentioned, obesity. We want to have 18 million less obese people in the US, 20 million less diabetics, 8 million less people that are food insecure. And although that we are in 38 states, we have an ability to deliver food to all 50 states. And in fact, as we begin to address food insecurity, we've recognized that it's not only in certain areas, it's a lot of areas, and how do we combat that and do our part? So we've instituted a Zero Hunger, Zero Waste campaign that's running in parallel to this Food as Medicine campaign, where we want to decrease waste in our stores and our manufacturing facilities and make sure that that food doesn't end up in the landfill and that we can get it to the food banks or those places that actually need it. I mentioned cost. We want to remove $58 billion in the cost of healthy, nutritious foods. We have to get rid of the notion that only the rich get to eat well, right? And that somehow eating a healthy diet is way too expensive. So if CPGs, these consumer packaged goods, and we've been working with folks like Procter & Gamble and Kellogg's and General Mills, if they want shelf space, they have to give us healthier foods and not jack the price up. That's a real scientific term, jack the price up. But we want to make sure that they don't raise the price and then outpace what we're trying to do in terms of improving people's health. And then so with that, we want 15,000 healthier SKUs in all of our stores to back this up. So next slide. Right, that was it. I got through it. Thank you.
Great. So thank you to both of you. Cora and I will now have sort of questions for you. And I think what struck me is for both of you is really your, I would say, you're paying attention to the consumer. We've always talked about the health of the consumer, and I think that was a disruptive term too when we started it. And I would say that, you know, especially with the pandemic and what's to follow, we know there's a lot of challenges on the behavioral health side because people, there's depression, et cetera, all the things you're talking about might have been, you know, they might also get to, I would say, people, you know, consuming drug and alcohol. So just curious about, you know, what, from your perspective, what are the trends? Clearly, it's clear to me you're adapting to those trends and sort of, you know, and how are you going to adapt and continue to expand your services? And I know both of you do also, you know, mental health screenings and also services. So can you talk a little bit about how you might be helping the client now, or the consumer coming into your store now on that side, but also how you see the trends the next couple of years and how you're planning to adapt some of the services maybe in the clinics?
So I can kick off this discussion. I would say a couple of things. One is, you know, related to consumerism in general. You know, what are we seeing? What am I seeing in healthcare? I would say that patient expectations are heightened today. Patients are expecting that they expect it to be easy, that healthcare is easy to access and to utilize, and that as a healthcare organization, that we meet them where they are, that we create options and an omni-channel experience, you know, whether face-to-face or through virtual care, for example. They expect us to have services that meet their immediate healthcare needs. And I would also add that they expect us to care, to deliver care that is compassionate in nature. So they, you know, just in terms of just in general broad sweep, they expect and they want to trust in the quality, the affordability, convenience, location, and speed of healthcare delivery. And I would say, you know, as part of this, particularly coming out of the pandemic, one of the things that, you know, that we did at MinuteClinic and continue to do is to accelerate our virtual care options during the pandemic and continue that post-pandemic, as well as continue to operate and deliver access to care through our brick and mortar locations across 35 states and DC. I would say, so that's just in terms of just general care delivery. I would say in terms of care services, certainly being open and there to meet the changing needs of our patients. So this past year in particular, the needs of our patients changed during the pandemic, and at MinuteClinic, we pivoted our resources and assets, and you know, we're committed to meeting the changing needs of our patients as a result of COVID, and we launched services to support COVID testing, for example, and then across the broader enterprise, immunizations. I would say, you know, as I look at care in a post-pandemic world, being there, having our doors open and able to care for patients in our clinics, particularly those who may have delayed care, is important. We continue to expand our scope of services to meet the needs of our patients, and some of the key areas today, not only certainly care delivery for acute, you know, common acute presentations and immunization needs, but also in the, you know, assessment, monitoring, for example, of chronic conditions, you know, high blood pressure, diabetes, high cholesterol, for example, is important. And the other area that we've responded to the shifting needs of our patients is in the area of mental health. So, you know, today people are more overwhelmed than ever. The mental health crisis has been exacerbated by unprecedented events this past year and a half. And at the same time, the traditional mental health care system is complex and can be difficult for patients to access, especially in an environment of expanded need. So earlier this year, CVS Health at MinuteClinic, we added licensed therapists primarily focused on treating mental health issues as part of the MinuteClinic care team at select health hub locations, specifically in Houston and Philadelphia and Tampa, and we're expanding. And this was to establish a new channel for real-time support and connection to appropriate mental health care. I think as we continue to assess the needs of our patients and move forward, certainly in supporting their changing needs as in a post-COVID world, as well as continuing to deliver on our pillars of access to affordable quality health care, continuing to expand scope of services in support of their changing healthcare needs is a deep commitment.
Marc?
Yeah, I would echo what Angela has said as well, right? I think what we've learned coming out of the pandemic, and just like Angela and her team, we needed to be there for our customers. So we stayed open during the pandemic when many primary care offices closed, and so that was a deliberate choice. If we were going to close during the pandemic, many of us said, well, then why reopen, right? So if we're going to not be there for our customers and for our patients, let's reconsider this. And so we put some things in place through infection control and those things to make sure we kept our customers and patients, and more importantly, just as important, we kept our associates, our clinicians, our nurses, we kept them safe. We've learned a couple of things through this pandemic. One is that mental health and behavioral health has always been undertreated. We've known that for quite some time. So even going back about 6 years ago, we've instituted a pretty robust screening program for every patient that checks in. So we have a quality check where we utilize things like the PHQ-9 or the GAD-7. These are screening tools that are deployed not only for things like school physical screenings that we do, or we do things like sports participation physicals. We deploy them for patients that are coming in, and that's been an important tool in our toolkit. Our 50-state telehealth service has been growing since the pandemic, and we've been doing that focused on seeing many, many more cases of behavioral health and those episodes, right? So something to note, that 1 in 5 persons in the United States will have a behavioral health episode in their lifetime. So it's not a insignificant problem, but we've recognized that through the pandemic and expect more of that to happen, right? So if you put 2020 together, there was the racial injustice. You had a really heated political environment. Then you had this pandemic, everyone being cooped up. That creates a lot of stress. And then for parents, right, that now are trying to homeschool kids, oh, God forbid. I mean, that has to be just really incredibly stressful. That's just tough. So last point, Tine, I believe, just like Angela said, we're not going to be relevant if we don't meet our patients and customers where they are. So large retailers like us are always considering, how do you meet patients and meet customers where they are? If our customers choose with their feet and with their wallets, and if we don't stay relevant for them, we don't meet them where they are, they will choose other locations. Today, if you look at our entire book of business, especially on the clinic side, about 2/3 of our patients are not attributed to a PCP, and we really want to help close that gap. We want a more connected or more continuity of care. Our places are great for the episodic treatment of chronic conditions, we should not be replacing folks like the pediatrician. So we need to put our arms around that and make sure that we get those patients upstream to our partners, our larger health system partners and primary care providers when that need is there. But we will remain available. Remember, we're only closed on Christmas, so we'll be there for our folks through the rest of 2021 and beyond, Tine. So it's exciting times ahead.
So I'm going to ask a question around. So it's a very good point around partnerships, because I know the group listening in, talk a lot about value-based care, partnerships, etc. In addition to really paying attention to the consumer, and I would say the consumer has not only been the partner with the clinics, but also with actually the association. Some of our big pushes on legislation was consumer-led. They were right with us, pushing back. In fact, they were some of the first in the first, I would say from 2006 to 2009, consumers was right with us when we got recognized by CMS. We actually, you're nothing unless you get recognized by CMS, but they were pushing with us. So I think that the role of the consumer and thinking of the patient as more of a consumer that has a right that sort of empowers them. But talk a little about your partnership, because I think that is key. How do you partner? What are the opportunities to partner with you? You mentioned hospitals, no doubt primary care providers, but you have employer relationships, and you guys have been very, I think, strategic in developing, the right access points, because again, and those of us who run, organizations know how hard it is to get, access for our staff to primary care, and yet you have enabled that and created that bridge. Just curious, you can just talk a little bit about your partners, how to partner with you, because I think there might be some, folks that are listening in that are just curious about how would one engage with that in their region.
Yeah, Tine, I'll go and then turn it over to Angela. We did something pretty unique during the pandemic. We recognized that the Trump administration asked us and asked many of the large retailers to come to the Rose Garden, and Angela, her CEO was there with our CEO, and they asked, how can you guys help with testing? So we partnered, with a laboratory right next to us there in Cincinnati. It's actually in right over in Covington, Kentucky. So it's really close to Cincinnati. But Gravity Diagnostics, at this point, we've done probably 3 million, almost 4 million COVID tests that are run through our system. We did that in conjunction with partnering with the state of Ohio, state of Kentucky, the state of Indiana, Texas, where we did drive-through testing at scale at these mass testing locations. And then we've done the same with vaccinations. So you may have heard just this morning that we've launched a community immunity program where we've pledged to give a sweepstakes for those that are vaccinated, $5 million, so 1 million per week over the next 5 weeks, as well as 50 winners that will get free groceries for a year. So 10 winners each week. So that's been a unique spin out of the Governor DeWine's vaccination sweepstakes that he ran, and we took a page out of that playbook. We have some strategic affiliations, Tine, that we have with large health systems. One is Ascension St. Thomas in Middle Tennessee, where we've partnered. And I want to be clear that these partnerships align organizations that are not just focused on partnerships with the clinic line of business, but with Kroger Health and largely with Kroger. So it's been unique how we've positioned that. And then finally, I think as we've launched our medically tailored meal kits, we've partnered with a couple of large payers to deliver those meal kits for disease-specific conditions. So think about someone has diabetes. How do I get a meal kit that's specifically tailored to them? Someone who might have chronic renal disease or have heart failure, so we need to have diets that are sodium restricted, right? So just thinking about how to get those meals that are medically tailored that can really improve someone's health. And you think about in a value-based care arrangement, if someone is discharged with congestive heart failure and they're eating the wrong foods, that can be an easy readmission, right? So we believe that this strategy of providing healthy foods offers a solution in that space to prevent readmission. And then finally, it would be all-cause readmissions as well, in my opinion, if we're able to do it successfully around a cohort of these diseases.
Angela?
Yeah, Tine, can I jump in with a question if that's okay?
Sure. Of course.
First of all, just wanted to say thank you to all three of you for really shedding light on, this great revolution in healthcare. It's been very insightful. My question for all of you is, as a consumer, do I think of the little clinic or Kroger's or CVS MinuteClinic and health hubs? Would they like replace, for example, my need to have a primary care physician, and Tine, maybe wearing your other hat, right, as with services? Would your consumers be able to go to a MinuteClinic for their primary care needs and really not need to have any other medical provider organization? Or do you see yourselves more as sort of triage? I woke up with a sore throat and I can walk in and get help at CVS. Do I go?
So I would say we see ourselves as a complement to the broader primary care-based health system, and filling in that space in between the access to a primary care provider and having an immediate healthcare need, and your only access point is a much more expensive emergency room, for example. And at MinuteClinic, and now through our health hub concept, we see ourselves as a place where we can help the healthcare consumer through coordinated care, as well as fill gaps in care, particularly for those who find themselves without a primary care provider for whatever reason. Maybe they changed jobs, or their PCP retired, or they moved to a different state, or perhaps it's a Sunday morning and they're not able to access their primary care provider. And creating this additional complement to support the work of the broader primary care system is how the place where we see ourselves in supporting and creating a seamless experience for patients. And in MinuteClinic, in our health hub model, which is a combined model between retail pharmacy and MinuteClinic, our purpose in that work is to combine retail convenience and face-to-face engagement that helps to support consumer health and meet wellness needs, whether it's our care concierge, who provides in-person support to help customers navigate the different resources within CVS Health, to the expanded role of the pharmacist, who helps the patients with closing medical and pharmacy care gaps, to MinuteClinic with expanded services. For example, a diabetic patient who hasn't had their annual retinopathy screen done, that we're able to do diabetic retinopathy exams within MinuteClinics located within health hubs, to our private spaces in select health hubs, where we have opportunities for one-on-one coaching, or community spaces for group activities, as well as personalized interactions focusing on supporting med adherence, for example, in certain chronic care conditions, as well as convenient health and wellness items within our retail store. And we see this combination and coordination of care located right in the community, at the front door of patients' access to healthcare, working together to leverage all of the resources and healthcare professionals within the enterprise to provide support to the patient that is complementary to the work of primary care. And, we talked about partnerships. Marc talked a lot, gave great examples of partnerships. And I would say that, for me, that has been one of the most exciting things about working in the convenient care retail clinic space, is just the possibility of partnerships where previously perhaps there just wasn't a lot of that happened. So the ability to partner across healthcare organizations, or the CVS Health Hub partnering with primary care, for example, or employers to do things like deliver biometric screenings or smoking cessation visits, for example. I think for the healthcare consumer, it creates this truly, we can create a seamless and connected experience where there, you know, in all of these different touch points within their healthcare ecosystem, there's coordination, and there's alignment, and everyone is moving the patient towards the same end, which ideally is optimal health and well-being.
Awesome. So you would be coordinating with a person's primary care provider or with their specialty care provider to ensure that seamless experience.
Yeah, so within MinuteClinic, we ask every patient at every visit, you know, to identify who their primary care provider is. And with the patient's permission, we share records. If they're also on the Epic system, that happens through the Care Everywhere portal. For patients who, and it's an important question, because for patients who I say that who don't have a primary care provider, and that, you know, still remains not an uncommon occurrence, the work of MinuteClinic providers to know their local resources and give recommendations and help to advocate for patients is really important. And I think as we think about even how do we continue to build on that in terms of helping patients not only to plug into the broader primary care-based health system, where can we also create tighter, stronger partnerships within our communities to help also address social determinants of health, for example. So partnerships cannot be overstated as an important part of the work that we can all do together to you know, advance health and well-being across our country.
So, I just want to put on my Woods Services hat, which we have 6,000 staff in 2 states. Unfortunately, not yet in Marc's states, otherwise. But I would say one of the first things when I came on board as CEO is that I wanted a contract for our employers. You know, as a, you know, we're self-insured. The first thing I went to Angela and said, we need to have a contract with you for MinuteClinic. We incentivize our staff to go to MinuteClinic. Here's the reason why, and we would do the same thing with Little Clinic if they were in our area, because the part of the issue we see as employers is that there's this people romance about primary access to primary care and having a primary care provider. We find that probably 40% of our workforce do not have one, do not want one. They might have other relationships. So the key for us as employers, and all of us, is to keep costs down. This is high quality, et cetera. You know, we have it meets all the needs we have, but it also keeps people out of using an emergency room for primary care, which still happens, or even in urgent care, other higher cost places. So I think that the question is also from, I want to put my employer hat on, is that this makes a lot of sense because primary care remains a challenge in this country.
Great, thank you. Marc, did you have something to add to that?
No, Angela covered it well. You know, I think she used the word complement. It's a complement to the broader health system. Also, maybe just to add that we probably sometimes don't give our patients and consumers enough credit. They're smarter than we think. And as conditions get more serious, they tend to migrate to higher levels of care by default. You know, I see in our population that upwards, like I mentioned, 2/3 don't have PCPs, but as just like Angela's team, we want a PCP on the chart, and we communicate back through our interoperability channels to make sure that that information is shared with the PCP. But what I'll add, Mina, is that you're likely to see changing legislation. We've learned this out of COVID, that more and more nurse practitioners will likely have full practice authority in the next several years, which then begins to create additional access points where primary care may be now solely in the hands of nurse practitioners to some degree. It doesn't mean that the nurse practitioners will not continue to do things like work in retail health, but in our setting, we are a complement to the broader healthcare system, not a replacement.
And you could be making referrals to that to those higher levels of care if somebody sees you as an entry point. You know, I'm grocery shopping, I see the clinic, I walk into it, and maybe from there you could refer me to somebody else for needs that can be met within the clinic. that possibility?
Yeah, absolutely. That's the complement that Angela was describing. And so, for example, we do a lot of age-appropriate screenings that go on in our clinic, and we also want to deliver age-appropriate vaccines as well. And closing those gaps in care, like Angela mentioned, we're not equipped, for example, to do things like a colonoscopy. So if you're that age and you're due for a colonoscopy, we're getting you upstream. We're helping you with that appointment. The same for mammography, right? The same for those types of things, that we're making sure that you get upstream for those screenings. And if we uncover something that is more acute or more serious that warrants further diagnostics or other capabilities, upstream. We want to simplify that and help those patients get to one of our partners because we don't want them just wandering into the emergency department. My wife's an emergency department physician. She's an ER physician. You go see her for your sore throat, she's going to send you a bill for about $4,000. The average cost of that visit in our clinics is about $60. You do the math.
I think and Marc is absolutely spot on. What I would say is, I think one of the myths about retail healthcare, and maybe this is from very early days where it was like, you're sick, we're quick. The practice has really evolved, and I know leaders like Marc and my organization, we've really evolved towards complementing the work of the broader primary care-based health system, and not only addressing and that means not only addressing the immediate healthcare needs, but really looking at the patient holistically and filling gaps in care, taking every opportunity to provide all the care, as that visit to one of Marc's clinics or one of the MinuteClinics may be the only time that person is accessing care that year. And our practitioners address the immediate needs while also, screening patients. And I was touring a couple of weeks ago, and a practitioner was sharing a story about how she saw a patient in her clinic for a cerumen removal, earwax removal. And during the pandemic, he did not have a primary care provider, hadn't received care in a year. And during the visit, she, checked his blood pressure. He had very elevated blood pressure. So she was able to address his immediate concern, which was, I can't hear out of I have earwax, address that while also, assessing his blood pressure, getting him appropriately assessed and on his way, while also working to engage him, get him connected to a primary care provider for ongoing care. So addressing his immediate concern, identifying a health condition that he had that had been going unattended, getting him started on his care, and being there to support him while she's working to help bridge him back into primary care.
So then it would be useful, I imagine, Angela and Marc, for people like our members, traditional providers of behavioral health services, to be known, right, as a resource to the people who are staffing your clinics. It would be great if you would know who you could refer people to, who is the primary care or who is the specialist that you can send people to when they need more care. So it would be good for our people to also be proactive and to form those partnerships with you.
And, this is a great point. Yeah. I mean, we've always, as a trade association and others connected, or, and we can help you with that. We know kind of all the primary care providers that have open slots, that's been the cornerstone of the industry from day one. I think we can be more proactive with you as a trade association to get that, Mina, because I think that there's no competition here. There's only enhancing the care. And if anything, I think the retail health has really enabled the primary care, has made the primary care system better, because there are those, we are able to fill the gaps where people using the unnecessary places before. So no, I think that's a great suggestion, great strategy.
And it's so important to the practitioners who staff our clinics to know who is available in their community. And they all, do local outreach and really try to keep, have a knowledge of who's available in my community, who's accepting patients, who can I call right now if I have someone right in front of me who I can send to, instead of sending them to the ER emergency room if it's medically, not an emergency. Like for example, a newly diagnosed diabetic, or someone who needs something that is outside of our scope of service. And these are such important relationships, and not only do we expect our providers to know their local resources, build those relationships, have that in their pocket for patients to support the appropriate referrals of patients or transitions of patients to the right level of care, but are being able to know as well and provide them with that information and even knowledge about what's offered at different organizations and different centers is important.
I'd also add, that Medicaid is likely going to continue to expand. We expect that to expand by 10% through this year and potentially through 2022. And many of the folks in retail health, and I can speak for the Little Clinic, are part of most state Medicaid plans. So we are able to accept that as payment so that they can be seen. And so again, that's the same for Medicare. So I anticipate those roles, and it's probably often, maybe I should provide a bit more color, since it's been declared a public emergency by regulation. They can't throw anyone off the Medicaid rolls right now. So that's going to contribute to the expansion, and then also with the pandemic and the loss of jobs, many more people are now on Medicaid than previously in 2019. So
fabulous. So on that note, speaking of Medicaid and social determinants, like you referred to, your program, Marc, the food medicine, is absolutely leading. And right now you mentioned that you are working with a couple of payers who cover that program. So, I mean, could I maybe as a consumer directly sign up, or could provider organizations that want patients going to them to benefit from your program connect them to you? What kind of partnerships are you looking at down the road on that program? And
so
really on all your websites?
Sure, yeah. You as a consumer right now can go to krogerhealth.com and sign up for free telenutrition visits right now. And so can all of your members. That'll be running through the, it's not a shameless plug, of the rest of this month and part of July as well, but that is available immediately. As we look to define things like a food benefit, working with the payers, that's a little bit different. We're primarily focused on the Medicare Advantage side right now. The MA plan has a food benefit written into their medical policy, so we're exploring avenues with those payers. But and I think when we look at the overall health and well-being of any population, Medicaid, Medicare, Black, Brown, it really, men, women, sometimes we overlook nutrition. We overlook how important food is to those populations. And when we look at social determinants, we think about food in that space, but everyone has needs, right? So every population has specific social determinants. We have, with our analytics team, have developed I mentioned the Assure Care platform. We've developed opportunities to leverage SDOH, leverage our communities and community partnerships in a way that surface opportunities to close those, whether it's a transportation issue, when we've partnered with folks like Lyft and Uber to get folks in for vaccines. If transportation is an issue, how do we solve that? And we solve that at the individual level by surfacing those insights, and then using some of the technology that we have to get very granular down to the almost census block level of information to know what is available, but also what those risks look like in that particular community. So that gets that. It gets us a little bit fine-tuned when it comes to delivering some of those services and then providing it upstream to the payers.
That's awesome. And Angela, I will visit the CVS Health Hub because one opened just very close to
Oh,
me
terrific.
a couple of weeks ago. So I'm just going to be fair here.
Please do.
Good.
Excellent.
So we're coming up on the hour. So Mina, Corey, are we ending now, or do you have some final comments? Because I think we're ending at 2. Is that right?
Yeah, thanks, Tine. Thanks, Angela and Dr. Watkins. Thanks, Mina, for jumping in there. I had some connectivity problems on my end. Yeah, we'll just do a quick wrap up here. And, my big question here is to echo what Angela said, what was old is kind of new again. And there's a lot of opportunity here. There's a lot of opportunity for what Health and Human Services would call integrated care. And the number that really sticks out to me is that 19 or 20% of US adults is already using retail. Well, let's say that doubles or triples in the next 24 to 36 months, percentage-wise. Does that change the rubric and the potential you guys see for this kind of an outlet to address the community need that you guys are seeing?
I'd say yes. Angela?
Of course.
Yes, I think it further highlights the opportunity around coordinated approach, partnerships, use of digital and IT, to meet the patients where they are and meet their needs, particularly as they evolve. This past year showed us, being able to pivot and do that as well is an important part of optimizing health and well-being across our country. I think it just highlights the opportunities in the importance of all the different touch points that make up a healthcare consumer's overall health experience. And we can deliver health in so many different ways and in so many, innovative spaces by, coordinating, partnering, collaborating, and leveraging all of our resources and capabilities and talents, having everyone in their individual spaces work to the top of their education, training, licensure. We all contribute, and I think it's together that we are truly going to advance health and well-being as a country.
And I would say
Thanks,
I
Angela.
echo what Professor Patterson says.
The one thing I just want to say is that when we talk about top of the license, when we talk about innovation, expansion, all of us in common, Mina, you asked, I think we all have this. We have to have a regulatory environment at the state level that's supportive of this. We don't always, and that's where I think there's other opportunities too with some of your subscribers and others, that we have some of the same regulatory challenges about access to care, telemedicine, et cetera. We've been very lucky through the pandemic that some of those things have gone away because we needed to. We need to continue to push for that, because if not, you're going to have unnecessary restrictions in terms of states, et cetera, and that might impede what your question, Corey, in terms of expansion and our opportunities to be much more creative in healthcare. Marc?
I think you covered it, right? And if we are able to double, that's a good problem to have, right? To have more people using our services. It's a good problem to have, Corey. So hopefully we will grow and obviously take that extra volume.
We are all needed. There's a huge need and there's room for everyone, right?
That's right. And, I'll make one more quick comment. We want to, at Kroger Health, we want to help people live healthier lives, but we know we can't do it alone. And if we're going to change the way healthcare is delivered in this country, we need partners. We need people like Angela, Tine, and Corey, and Mina. We need to not think about it as just competition, but doing what's right for patients.
Absolutely. Well said. Thank you. Thank you all. This has been phenomenal.
Thank you.
Yes, I would like to echo. Thank you guys very much. And before we get down the road, I just would like to share with our audience that we will be back next Thursday, same time, 1 o'clock. And our very own Carol Clayton, Senior Associate at Open Minds, is going to deliver data-driven decision-making for the post-pandemic market. And we look forward to seeing you all there. Thanks again, guys.
Bye.
Thank you.
Thanks, everyone.